If you look at the healthcare industry and the medical system, you see a massive machine engineered to distribute services through the talents of healthcare professionals to the grand population at large, preserving the integrity and sanctity of every facet of life. Except for millions of patients and most healthcare practitioners, the last piece may not ring true, the part about upholding integrity, protecting the sanctity of every facet of life. The truth is, we've drifted far, far away from providing meaningful, comprehensive care when it comes to pain or addiction. That's right, we're separating the two. Why? Well, the integrity of care that has been lost is related to one simple centerpiece, and why our healthcare system today looks so much more dystopian than utopian. That is, no one upholds and follows what science tells us anymore. Here's how healthcare is supposed to work. Physicians are supposed to be ensuring everyone follows science effectively. They're not. Science starts in research and the result is innovation, as has always been the status quo. Science, the summation of human knowledge built upon itself. Instead, science is being hijacked by agents of medicine one pill at a time. The result? Doctors are paid by prescription to dole out pills to patients, everyone, from an anxious patient to one with burns to someone with a foot cramp. Put them on a narcotic and have them come back in a few weeks. That's millions of people on pain pills that can cause cruel damage to their mind, body, and soul, all in the name of numbing physical discomfort and calling it a day. Herein lies the true damage our healthcare system has unleashed. Healthcare is operating in a state that ignores we are human beings with mind, body, and soul, leaving patients with a spiritual bankruptcy that's gruelingly exacerbated by shallow levels of care, with nowhere else to turn other than self-sabotage. Let's take any patient, perhaps a young woman. She's in her 20s, maybe 30s, and she's creating a life for herself.
Hello.
Growing up, she was the product of some abusive relationships, which resulted in seeking more abusive relationships as she matured, and soulful scars that she tried to escape. Then she gets in a car accident. It's minor, and she walks away. But she is left with back spasms. Although her pain is only temporary, she gets put on painkillers. That's it. No physical therapy, no massage, no muscle relaxants, no counseling, no treatment dealing with the trauma of the accident, nothing. Just pill after pill. Suddenly, she feels great. Whatever the pills are doing, even those scars on her soul from her abusive relationships don't hurt as much. But what does rear its ugly head in full force is her spiritual bankruptcy, and her addiction takes hold. Years before, in those abusive relationships, she was made to feel worthless, and that abuse was the norm. She was physically, psychologically, and spiritually beaten down, leaving her without hope. Her only way out was finding something that made her numb, especially if that something had the added flavor of abuse. The result was repeated toxic behaviors, even though she knew they hurt her. That's addiction. That's why, when that feeling of worthlessness is fed from her newly found narcotic abuse, her addiction tells her that this is the new normal, and she clings to those pills until she becomes a statistic. That's a sad story, but we've all heard it. The problem here is not confined to one patient. Millions of patients experience this every day, and that's why we see the opiate crisis take an innocent life almost every 30 minutes. All the while, the medical system profits and turns a blind eye. The real problem is that healthcare providers, pharmaceutical manufacturers, insurance companies, even some patients themselves, up and down the entire medical industry, are not following what the science says. Look at any publication, piece of literature, or review article put out since the 1980s, from the United States Department of Health and Human Services to the CDC, the Surgeon General, and all others. Whether you see the patient in person or with telehealth, Every piece of science states that you must combine all forms of care together and give a comprehensive care to every patient, including counseling, physical therapy, intervention, measured medications, along with a genuine understanding that because you were created on purpose for a purpose, you have inherent worth. Pain is not simply physical. Pain, by definition, is a feeling of discomfort described in terms of actual or perceived damage to the body, mind, or spirit. It can beat you down and rob you of your willpower, your individuality, and your soul. That's where addiction comes from and why we always hear the line. Dependency and withdrawal are not the same as addiction. Not everyone who takes substances will fall into addiction. That's why MD Health Clinics is not just the way forward. It always has been the way forward because it follows the science before it. Science simply hasn't been so profitable for everyone involved. Right now, pain is a profitable and effective way to fill the medical industrial complex's coffers, not caring that a patient's precious life could be headed for a coffin. If you're a healthcare provider who needs the resources to give patients truly helpful care beyond a prescription, follow the science, or get in touch with MD Health Clinics. We offer a top-down, comprehensive approach, including counseling, physical therapy, intervention, measured medications, telemedicine, and a true understanding of pain and addiction and how to treat them. If you're a patient, don't gamble with your life. Get comprehensive care. It may be the one thing that saves your life. You deserve the opportunity to take control of your life, the way you choose to see the world, and your ability to own your reality is the path to true prosperity of the mind, body, and soul. MD Health Clinics can help you understand how to manage your pain in every way, from the way you treat your body, the way to understand your mind's view of your pain, and the way you nourish your soul. Say no to a spiritual bankruptcy. Say yes to a spiritual revival, self-empowerment, and better health care. Learn more. Follow the science before you. Go online to mdhealthclinics.com. Whatever you do, do it today.